All right. Good day, ladies and gentlemen. This is Abdullah Mtairi from Johns Hopkins Aramco Healthcare Population Health Department. And our webinar today will be talking about ways to prevent hypertension. Let's start by the definition of blood pressure. Blood pressure is the pressure of blood pushing against the walls of your arteries. Arteries carry blood from your heart to other parts of the body. The blood pressure normally rises and falls throughout the day. So what does the blood pressure number mean? So we need to know the numbers. So whenever we get our readings, we know where we stand from the normal to elevated to high blood pressure. So blood pressure is measured using two numbers. The first number called systolic blood pressure measures the pressure in your arteries when your heart beats. And the second number, the below number, is called diastolic blood pressure. It measures the pressure in your arteries when your heart rests between beats. If the measurements reads 120 systolic and 80 diastolic, you would say 120 over 80, or you write 120 slash 80 millimeters of mercury. That's the reading of blood pressure. Systolic goes above, and then the lower number it's called diastolic. So what levels of blood pressures are normal? We should know the classification of the numbers, so we know if the blood pressure, if our reading of blood pressure is normal or elevated, or we have high blood pressure, or what's called hypertension. So the American College of Cardiology and American Heart Association guideline for the prevention, detection, and evaluation and management of high blood pressure in adults 2017 guidelines says the normal blood pressure lies between the systolic less than 120 and the diastolic less than 80 millimeters of mercury. And if the reading is between 120 and 129 for the systolic, and the diastolic is less than 80, it's called elevated. So this person is at risk of prehypertension. And if the reading stands between 130 diastolic or higher, and the diastolic is 80 or higher, this level or this stage is high blood pressure, and it diagnoses as hypertensive. So we should know all these numbers. So next time you go into the clinic and you get measured at the nursing before seeing the physician, at least you know the numbers of the blood pressure readings. So you know if your blood pressure is normal or elevated or hypertensive, and based on that, you get the diagnosis that you need, and you might the person who goes to the clinic might need medication or just small changes in lifestyle. And in our webinar today, we'll be talking about ways to prevent hypertension. So hypertension is a big problem across the world, and in the Kingdom of Saudi Arabia, hypertension is a leading risk factor for morbidity and mortality. Untreated hypertension may lead to serious health conditions, including stroke, coronary artery, kidney artery diseases, and many other health problems. Saudi Health Information Survey did a random survey of 2,735 individuals age 15 years or older, revealed the following. So they did the survey for the 10,000 people, and the revealing of the study shows that 15.2 are hypertensive. And from the 15.2%, there are 57.8 people are undiagnosed with hypertension. So that's the problem. Almost half of those people, they don't know they have hypertension, or they undiagnosed with hypertension. And 40.6% of those people are at the risk of developing hypertension. They are at the borderline of hypertension. Well, we should know that non-communicable diseases kill more than 90,000 people per year in the Kingdom of Saudi, and they're responsible for 78% of all death. Cardiovascular diseases alone accounts for nearly half, almost 46% of all death rates in Saudi Arabia. So hypertension and cardiovascular diseases uh, get the half of the death causes in Saudi. So this is a big problem. It's a huge problem in Saudi and across the world. We need to work towards the problem. We want to get to the bottom of the problem and try to help the population uh, prevent or delay developing hypertension. So let's get to the facts and figures of hypertension prevalence. In the US, 75 million adults are diagnosed with hypertension. So almost 33% of the population are hypertensive. So 1 in every 3 people are hypertension. Numbers in Saudi shows that 15% of the Saudi population are hypertensive. 17.7% the male are 17% hypertensive, where the female is a little bit lower than that. It's 12.50% of the female in Saudi are hypertensive. In Johns Hopkins Aramco Healthcare, in our hospital here, we have 9.7% of the male are hypertensive, and with the female, 9.4% of the female in Johns Hopkins uh, provider who take their care from Johns Hopkins are 9.4% of the female are hypertensive. And as you can see in the chart here, we have 37% of causing death in Saudi is cardiovascular diseases. So almost a third uh, of the chart, and cancer equal to 10% of the death rates, diabetes 3%, and communicable and maternal diseases is almost 8%. So high blood pressure levels may cause and lead to, well, it starts with excessive pressure in the blood vessels walls. This excessive pressure will weaken the artery walls and make it become less elastic and thicken the blood pressure, the blood vessels and arteries walls. This also cause heart attack and stroke and kidney diseases. So it starts with the pressure that on the blood vessels walls, excessive pressure constantly leads to weakening these walls and make it less elastic and thickened. And this, at the end, lead to heart attack and stroke and kidney diseases and other health problems. So some of the hypertension complications, hypertension could lead to heart failure and stroke and kidney failure, and also could affect our focus and memory. We might have memory difficulties, and sometimes we have focus problems, and that's the least of the problems that anyone would like to have throughout their life course. So, what are the risk factors of the hypertension? What could lead to developing or having hypertension? Well, poor diet. It starts with the what we eat and what are our eating habits. Poor diet could lead to obesity and could lead to hypertension, and also not having enough physical activity. We're not exercising, we're not doing the bare minimum of physical activity during the day or the week or the month. So we have problem with our physical activity. With a sedentary lifestyle could lead to hypertension. And also one of the risk factors that we don't have control over is aging. So as the people age, uh, the more they tend to develop chronic diseases, and one of them is hypertension. And also hypertension could also be genetic. So sometimes often people will inherit the hypertension from their parents or in their family, or if it's in the family history. And also stress and anxiety also plays a role into developing hypertension. And smoking tobacco and its product, whether it's cigarettes or shisha or electric cigarettes, also plays a huge role into developing hypertension. It affects the artery walls, and this also affect our hypertension and blood pressure. So now let's start talking about preventing and controlling hypertension. Well, first of all, based on the diagnosis, the treatment plan is discussed with your physician, should include some lifestyle changes, such as being more physically active and modifying our diet. And sometimes, in addition to that, a physician might prescribe antihypertensive medications. So the impact of a healthy diet and lifestyle on blood pressure are well known from efficacy studies. For example, developing or following a DASH diet, reducing the amount of sodium that we intake during our day, and being more physical active. And with the weight loss, if someone is overweight, can lower our blood pressure as much as antihypertensive medications. So the major plan to prevent hypertension start with exercising and being active, and also managing stress and anxiety, and also maintaining a healthy weight, and quitting or avoiding smoking tobacco products in general. So if we're talking about physical activity and trying to be more active, we should start by talking about the aerobic or cardiovascular exercises. It helps strengthen our heart, our lungs, and heart muscles. So aerobic exercises is one of the main physical activity that we should follow. And it could be the intensity varies. It could be moderate exercises, and it could also be intense exercises. And that's the latest guidelines of the duration of our physical activity and the intensity. That's the latest guidelines. So if the training or the physical activity is moderate with the intensity, so let's say 50 to 70% of the maximum heart rate, we should develop 150 minutes per week of the physical activity. So that's almost 30 minutes for 5 days, or more for less days. And that's the bare minimum of the physical activity that we wanted in order to achieve our goal of lowering our blood pressure. Examples of moderate intensity exercises could be jogging and fast walking, swimming and cycling, and some other sports such as tennis. And if the physical activity, or if the activity that you're doing is intense, and that's measured by the heart rate, if it's 70% to 85% of our maximum heart rate, we can lower our time or the duration of physical activity to 75 minutes per week. And examples of the high intensity workout could be running for like longer time, and hiking, and racing, and rope jumping, and other physical activity. And to measure the maximum heart rate, to know where we stand with this, you just uh, take 220 minus your age. It gives you the maximum heart rate. So we talked about the physical activity and the importance of being active and not having the sedentary lifestyle. Now let's talk about uh, following a healthy eating habit. It is important to follow a healthy diet. So the food we take, it could be our medicine or could be our disease. So in if we're talking about hypertension eating habits, we have to focus into the salt intake. So adding salt during cooking or at the table is not only the only source of excessive sodium. Up to 70% of our daily salt intake can come from ingredients and already in the ready food items such as bread and breakfast cereals, prepared and packaged food. So sodium and salt plays a huge role in hypertension and raising blood pressure. So we should start by cutting or reducing the salt intake in our day-to-day eating habits. So we should know that adding salt is not the only way of having salt. Sometimes some of the packaged food we take from the grocery is also having salt or sodium in it. And one of the ways to cut sodium and salt from our daily food is replacing it with uh, other substitute. So we can substitute the salt when cooking or eating foods. We can substitute it with herbs. It gives natural and nice flavors. And we could also add spices, lemon juice, and other flavor enhancers. Because some of the times people find it difficult uh, to having food without salt. Salt is one of the ingredients that most of our food rely on it. So it's smart to replace it or find the substitution that could work for us. And that could be lemon, spices, ginger, and herbals, and all of that can taste good and with less harms of the salt and sodium. For example, you can add black peppers to the eggs or pizza or soups or seafood dishes, and also fresh herbs and spices to the vegetables and meat and pasta. Also, sometimes we can also have garlic or ginger or pepper and lemon juice can all flavor rice and potatoes and whatever dish that we want to have during the day. So it's important to reduce the salt intake. The guidelines said maximum 2,300 milligram of salt. That's the maximum we should take in our daily eating habits. So it's important to lower that, also lower than that, to avoid rising blood pressure. And one of the ways to have smart and educated decision when purchasing a product is to read the nutritional labels and select reduced sodium and salt items. So when you grocery shopping, compare all the different options by reading the nutrition fact labels. Try to choose items with less than 5% sodium content per serving. This will mean less salt and added to these items compared to others. As you can see in the picture, you can see the calories and the total fat and cholesterol and sodium and potassium and total carbohydrates. All these nutrition facts, we should go over it when purchasing a product, and we should focus on the sodium content. It should be less than 5% of our daily value. And also, in order to develop healthy options with food, we should replace canned food with fresh. We should always try to consume fresh products. Make an effort to avoid processed and preserved and canned food, such as cold cuts, smoked meats, and fish, which are typically high in sodium. It's not healthy sometimes, even if the ingredients or the product itself is healthy, but with the processing and the preservation and having it in a can could be typically high in sodium. So instead of that, we should consume more dried beans and legumes and fresh fruits and vegetables. And also, if it comes down to it, and we have to take or have to consume these packaged or canned food, just by washing it and draining it can reduce their salts content by 50%. So going through some of the high sodium foods that we should avoid or cut or minimize. Uh, one of the Here we've come up with the list that's high in sodium. We should start by shawarma and burgers and fast food sandwiches, and also pickles and sauces are very rich and high in sodium. Also olives and fast food meals and some of the dried foods, uh, some of the breakfast cereals and packaged soup and stews, and canned fruits and vegetables. So even if normally fruits and vegetables are healthy, we want to consume as much as we can. It's recommended that we always go with the fresh options because of the because some of the canned fruits and vegetables are rich and high in sodium, and we don't want that in our daily eating habits. And one of the factors and nutrition element that we want to consume more in our eating habits is potassium. Potassium plays a role in regulating the blood pressure uh, and helps lower, actually sometimes lower the blood pressure is potassium. So potassium and magnesium and calcium, all these minerals, we need to focus on and consume as much as we can from them because it's healthy and it can lower blood pressure. And where we can find potassium, we've come up with some of the fruits and vegetables that are high in potassium, such as sweet potatoes and orange. Orange are rich in potassium, as well as vitamin C. And avocado is also is healthy, and coconut water and bananas. So we should consume more of that. That's why if we're talking about hypertension and the best diet to prevent or delay hypertension is DASH diet, dietary approach to stop hypertension, and DASH diet focus more into adding or increasing the consumption or the serving of fruits and vegetables. So speaking of DASH diet, the dietary approach to stop hypertension DASH diet does not require specific food items to be consumed or certain recipes to follow. Instead, it encourages consumption of specific amount or specific servings from each different food group. So it doesn't tell you to stop eating this or this and this, but rather just having more specific servings from each different food group. The number of servings, of course, depends on your daily caloric needs and allowance. So Dash Diet recommends consuming lots of fresh fruits and vegetables, along with lean meats and low-fat dairy products, and also calls for reducing sodium intake to be less than 1,500 milligram each day. Dash diet plans are more easy to be understood and followed by more people, and the recommended foods are vastly available in average grocery store. So it doesn't require specific amount of food or having healthy meals from specific restaurants. Rather, it's just It's available everywhere, but the amount of the servings of fruits and vegetables and lean meats that where we focus on in the DASH diet. So some tips that could help us develop and follow DASH diet. Try to consume light or low-fat options. Limit meat consumption, especially red meat, to 2 servings per week, and also add two servings of fruits and vegetables to each meal, and have fruits as snacks. So it's not luxurious option. We should have it when we can, and I mean the fruits and vegetables, but it's a main dish items. We should at least 2 servings of fruits and vegetables to each meal of our daily meals. And try to consume food rich in B vitamins, such as whole grain. And if you cannot digest skimmed dairy products, well, choose lactose-free options when possible. And add fruits and vegetables when cooking and preparing lunch and dinner. It's always must be an essential and main items on the table. So in Johns Hopkins Aramco in Dhahran this year, we started and we launched our blood pressure lifestyle management program. We call it Balsam. So it's a program based on diet and lifestyle intervention, which is proven to be very effective in lowering blood pressure. Balsam is a program that aims to improve the lifestyle, and it is dedicated to participants who have slightly elevated high blood pressure, or what is known as prehypertension. The program consists of 6 virtual sessions. Each session include brief educational video to take home messages that are shared with participants for their reference using my chart or WhatsApp. So 6 virtual sessions. The session tackle different topics. We talk about why is it important to know the numbers of blood pressure, and why is it important to know the readings. And also in Belsom we talk about sodium reduction and DASH diet and following healthy eating habits, and also you focus on uh, increasing the participants' skills and knowledge about physical activity and how they could follow healthy routine. And also the program includes 3 in-person clinic appointments to assess and monitor blood pressure and body mass index over the period of 3 months of the program. So 6 virtual sessions and the clinic visits at the Balsam Clinic. So hypertension is a huge health problem in Saudi and across the world. We shouldn't overlook the problem. We should focus on that. I hope by our webinar today you learned even basic knowledge on how to prevent or delay or control high blood pressure just by implementing and following a healthy lifestyle, just with minimum modification of our diet and trying to increase our physical activity. It could play a huge role into lowering and controlling our blood pressure. I hope you benefited from the webinar. If you need more information, you can just click in Johns Hopkins home insight, and you find all the information regarding the topic in our website. Thank you so much for listening and attending our session. It is my pleasure to present you hypertension or ways to prevent hypertension. Have a good day.